morning. You are tuned into 1100 WSGI, and this is Lee Marie with a special edition Go Show with Wild Doc that was postponed from earlier this month due to all the different crazy weather and everything. So glad that we could have Wild Doc here. Good morning.
Good morning.
All right, let's go to the Lord in prayer. Heavenly Father, thank you so much for today. Thank you for this special weekend where we honor all of our Vietnam veterans. We thank you for each and every one of them, for every person in their family that also had to make this sacrifice. We pray for this weekend's events, that they are honored and that you just take that all where you want it to go. And the show today, Lord, just have your hand on it and just give us the words you want us to speak. We love you. We praise you. We need you. In the mighty name of Jesus, amen.
Amen.
All right. Anxious for nothing.
Yeah.
That's one of the verses that I have to remind myself on times like these when I've got a lot of things going on.
Yeah. I could agree with that.
And I have to remember that, a lot of our ailments come from stress. And so when I feel myself like that, I got to breathe. And remember to be anxious for nothing. All right, Wild Doc. I know we had a question come in regarding ear aches, ear infections, and such. So you want to delve right into that?
You can, absolutely.
All right. Let me get
I will pull that up real quick and kind of read what you sent me. You said that there was a 77-year-old female who had pain in her lower part of her head on the left side, 6 weeks, took ibuprofen, Tylenol the whole time. So I'm going to break it apart in pieces. The catch-22 of that scenario is Tylenol and ibuprofen can actually cause problems with our immune system to be able to clean up damaged tissue. So part of healing is actually a mild, moderate, should be, some inflammation. So if we block inflammation, we could actually disinhibit. We can inhibit the ability of the immune system to appropriately clean up those tissues. And so it can actually cause a problem there. So you can actually cause a bigger issue because ultimately the lack of those two chemicals in your bloodstream is not the cause of why you are having pain. So anytime you have pain, do not reach for a medication. Like that's just a flat out, that's the way it goes. Like we've been ingrained in that over the years. She comes from a generation that kind of like was like, oh, modern medicine is this amazing thing. Less suffering, less pain. Pain is your check engine light. Like it has to be seen that way. So, there's likelihood that it at least didn't do anything for her, obviously. Right. And on the other side, she started taking it when she had pain and then didn't allow the immune system to do its appropriate work, clean up the tissue and get rid of that damaged tissue, and then it just keeps going on and on and on. So then she got an earache and pain in her right ear, then both ears. Her doctors said her ears were red, so they put her on 2 antibiotics. Here's one thing that is rarely discussed, but well-versed within the medical literature is that the vast majority of ear infections are actually viral and not bacterial. And so treating ear infections with an antibiotic goes against the science. So, but that's, you go to a man with a hammer, what's he going to try and fix your TV with?
A hammer.
You go to a man with the drugs, what are they going to throw at you when you have a complaint? Oh, you have pain. Let's throw pain meds at you. Let's block the check engine light. You have a check engine light on. I have duct tape. Let's put duct tape over it. That's it's the concept of using pharmaceuticals to treat ailments, unless you 100% know that you are going to lower the total body burden of an infectious disease with an antibiotic, then you're going to support the body's recovery, possibly. But then you got to deal with the side effects and the downstream effects that it causes harm to both good and bad. Good bacteria that should be there and resists repopulation of bad bacteria. So then you got to make sure that you're replenishing your good bacteria within your microbiome. So yeah, then she goes, none of that helped. Do doctor sent, it's probably text or speak to text here, so there's a little confusion. None of that helped. Do doctor sent her to a physical, then the doctor sent her to a physical therapist, but which you meant there. And after 3 times, pain was gone. That's great. So, when pressure could build up within the ears because you may have poor lymph drainage, so poor fluid drainage from that area, that ear canal. And that'll cause inflammation in and of itself. There may be some pathogens in there, but it doesn't mean that they're causing an infection. If there was no fever, if there was no heat, if there's just redness, that does not mean that you have an infection. They look in your ears and be like, it's red, must be infected. Kid has an abrasion on his arm or elbow, or, my little girl's got blisters now. If all you could look through is a little hole and see, oh, it's red, would we be like, there's an infection. It's red, it's infected. No, that's not the way it works. But that's what happens when you go to a medical doctor, just looks in the ears. And ultimately, let's just think about how the body works. So if you have pressure in the ears, one, the pressure's building up. So how do you relieve pressure from the ear canal? You relieve pressure by the lymph drainage. So if there's truly fluid building up, if there's pressure internally there that's causing discomfort and pain, you're supposed to relieve that through the lymph system. So the cervical spine has a large amount of lymph tissue around it, lymph channels. So appropriate movement is necessary for lymph drainage. Take people who sit in the hospital, sit still, don't move, even people with lymph problems, riding on airplanes, sitting still for long periods of time without moving, swelling, fluid pooling, that type of thing. It's the same thing. It's just happening in the ears many a times. So, and if there is an infection, there's swelling, there's inflammation. Typically that blocks lymph too, but you can facilitate better lymph drainage through a cervical spine adjustment or just cervical spine range of motion and movement. And so it's more than likely the PT was improving range of motion and working on let's move, move, move. Mm-hmm. It's so beneficial to move. And so I'm glad that she got relief with that. And that indicates, well, there's something biomechanically going on that's causing that pain. Well, goes on. Physical therapist did see that she was very tight in the shoulders and had several big knots. When the therapist pushed on those knots, patient would feel pain in her ears. That's just called referral of pain. And so when you start firing up pathways of pain through pressing on a knot in your shoulders, all right, if there's constant knot in your shoulders, then there's a problem with structure and biomechanics of the spine. That's how you form and develop knots in your shoulders. It doesn't just happen. It happens because there's chronic, unrelenting stress that's causing that. If I just had to sit here and hold a bowling ball out in front of me, day in, day out, never got relief because of the positioning of my arm, my biceps going to form knots because my muscles never got relief. So when somebody's developing knots, there is a structural biomechanical alignment problem in the cervical spine because your traps, your shoulders, that is where the big muscles attach that hold your head in position. So if your head is out of alignment, it creates more structural stress and tension on those muscles, just like holding that bowling ball further out, and knots are going to form. Now, pressing on those knots fires up your pain pathways in your nervous system. And if you already have some facilitating higher to closer threshold of other pain fibers, let's say in the ear, by firing up one pain pathway, you may actually fire up those others. So it's called a referral of pain. And so it can be a neurological metabolic mechanism affecting the increase in the sensory sensitivity of the pain pathway in the ears. It doesn't necessarily mean that like we press here and there's something like mechanically connecting ear to that. It's neurological. When the therapist pushed in the knots, the patient could feel the pain in her ears. The doctor scheduled her to get an MRI this Friday. Dan, she said the pain in her head initially.
Oh, he was recommending the MRI because of the initial pain in the head.
Gotcha. So not because of the referral of pain?
Well, I don't know. I mean,
yeah.
Exactly.
Gotcha. Didn't know necessarily one way or the other. Yeah. I mean, an MRI is going to be able to show soft tissue and, pain in the ears is very rarely ever going to be seen. You might see some inflammation fluid in there, but you're very rarely going to find what an MRI ultimately should be used for, which is a mass tumor, things like that. If she's not having other progressive neurological, no sudden onset of visual speech disturbance to, let's say, seizures or movement disorder or things like that, really this MRI is, that's what we pray for. It finds nothing or it finds something that's unrelated. That's the reality. Some people, there have been MRIs done on patients, and they find that they have 0 hemispheres of their brain, but they have close to normal or normal IQs, and yet they have a hollow space inside their skull. And they're like, but you have no neurological deficits. How could this be? And so that can lead to other problems. So it's just, if she doesn't have these, are they doing an MRI of her brain? Are they doing an MRI of her cervical spine? Like, where are they doing the MRI? Yeah. If they're, you have pain in your head, let's do an MRI. That, without a bunch of other clues that are showing you progressive neurological deficits or alterations, you're going to find probably nothing. Or you're going to find something that's probably in no way, shape, or form connected to her ears. So, if they find something, it's kind of like, don't freak out because you have no signs that it's causing a neurological problem. So if there was a mass within the brain, the scary thing that I see is like, whoa, you have a mass now. Well, you had no progressive neurological condition. Now somebody wants to go in there and bore a hole, stick a needle, and biopsy it and potentially do additional neurological damage or stimulate the tissue to actually grow more, because that's just like any wound that's created. Whether it be a cut, you've got to regenerate cells. And so after a biopsy, sometimes you trigger regenerative effects, cellular responses, and then you could actually, it's like poking a hornet's nest. There's going to be potential harms that come about it with a 77-year-old woman. If they find something, you got to take into account whether it's worth going in and potentially doing more damage to investigate whether it's quote unquote cancer or not. Because if it, so there's a lot of dynamics at play, but prayer is they find nothing on the MRI. Now, what will probably be seen on the MRI, again, the ears are innervated by cranial nerves, so you can get referral of pain possibly. There could be the mechanism of pressure buildup on the ears because they might and will likely find arthritis or deterioration to the discs in the cervical spine. It's extremely common. Like if she didn't have any of that, then she's probably one of the healthiest 77-year-old women out there, So, and that's, arthritis, joint disease, those are all going to restrict lymph drainage via inappropriate or ultimately locked up non-movable joints in the cervical spine that are needed to move so that lymph can drain so that pressure on the ears can be relieved. So, in chiropractic, it's like ear infections. Here's an irony of a story, small world. I grew up in Ohio in a town of New Knoxville. I went to Iowa last week to visit a functional neurology clinic working with children with developmental delays. I walk into the second exam room, and this mom goes, "Dale Brown." And I looked at her, and I was like, my temporal lobes aren't firing. I didn't really say that, but I'm like, because I'm seeing your face, but I don't remember your name. She remembered my name. And Stephanie was her name, and is a friend of mine, neighboring town. She grew up the same year I did in New Bremen, and she had 3 little boys, and one of them was dealing with what seems to be a basal ganglia issue, some speech and movement and eye tracking issues that is very likely the result of the inappropriate use, long-term use of antibiotics for ear infections, and then ultimately chiropractic resolved the ear infections. But because the infection, which is probably a streptococcal infection, wound up getting into the brain, there's cross-reactivity with streptococcal pneumonia. That's why people get fearful of strep throat. But the reality is the only kids I've ever seen clinically were on antibiotics when they got PANS, PANDAS, basal ganglia issues, things like that. I had one child that I was able to work with and significantly recover with the use of hyperbarics because it has both an antimicrobial but also an immunoregulatory effect. And when we saw that this boy started to have ataxic movements, basically inappropriate movements and twitching, he's moving when he's not trying to, he can't control his movements. So they wound up diagnosing with rheumatic fever, and he had a minimal amount of heart damage at that moment in time, but ultimately because of what we were doing with hyperbarics is probably what squelched that inflammation so rapidly that he did not need steroids and things like that. The Vanderbilt Children's Hospital, actually, the physicians were like, this is one of the best cases we've seen in terms of recovery and improvement, and no need for, further workup and, care. So, but in that regard, the central nervous system was inflamed and being damaged because of cross reactivity of bacteria. And this kid was on, the kid I just talked about and the kid there in Iowa were both on antibiotics for roughly 6 months. So it's like the antibiotic didn't even take care of what people most go to treat strep throat with is antibiotics. They're all on antibiotics, which creates an environment for immune dysregulation plus overgrowth of bad bacteria, because basically you can't kill all the bacteria, the bad bacteria, with an antibiotic. And if you just keep giving it, that is literally exactly the way they do Petri dish studies to show that they create antibiotic-resistant bacteria, because never does all the bacteria grow or get killed by the antibiotic. And then they kill off the good. That leads to immune dysregulation and hyperinflammatory problems, and then you wind up with more and more issues. And so that the boy in Iowa likely wound up with dysbiosis in the gastrointestinal system, overgrowth of bad bacteria, eventually immune dysregulation, and then hyperinflammation in his brain. Then now he's dealing with these cerebellar, ocular, and movement disorders and speech disorders. And so that's what they're there to utilize Dr. Josh Madsen's office to help that boy heal. And so, that boy had ear infections. Ultimately, the ear infection, sadly, after when he started developing the movement conditions and the speech issues and developmental delay, it was ultimately a chiropractor that adjusted the kid, and then his ear infection stopped reoccurring. So it's like, get to the root causes. Think about the way the body's designed. Like, how does it function? How does it heal? We have to learn to assist the body, work on the underlying mechanisms that drive symptoms and disease process, pain in the ears, things like that, so that we assist the body to heal, not just this old school way of thinking that is the medical model of just throw drugs at things and, well, it didn't work, throw it again. Oh, the antibiotic didn't work again, throw it at him again. Oh, the antibiotic didn't work, throw another one at him. Oh, the antibiotic didn't work, throw another antibiotic at him. It's insanity. Like, doing the same thing over and over again, expecting a different result is, the definition of insanity. And you look at the American healthcare system and how poorly people are doing in this nation, especially children, the next generations, with their health, with their mental health. We have to say we are not doing the right things to stop this epidemic of health problems, both in the elderly and in young adults and in children. We have epidemics of autoimmune conditions. The worst epidemic is the neurodevelopmental conditions going on in this nation, and we've just got to.
All right, people are already going to say, hey, give me that information. How do I get in a hold of this doctor? So why don't you go ahead and give them your information?
Office phone number is 931-591-2010. Again, that's 931-591-2010.
All right, and he's over in Clarksville.
Yep, off X11. So,
right. And matter of fact, there's something else that is towards that way, and I'm going to talk about them right now. and that is Coldstream Camp.
The Dunn family would like to thank everyone who participated in the tour of Coldstream Christian Camp during Experience Robertson County. Coldstream Christian Camp is now taking reservations. Ministry workers, men's and women's groups, small churches, and families will enjoy rest, retreat, and grow in the grace and knowledge of our Lord and Savior, Jesus Christ. Coldstream Christian Camp, partnering with families and churches since 1980. For more information, visit coldstreamchristiancamp.org or call 615-696-2208. 615-696-2208 and tell them Lee
Now is
Marie
the time
sent
to
you.
clean out that shit.
All right. Yes, Coldstream Christian Camp is in Adams, guys. That is just, and it's not very far. Like if you were on Kinney's Road and you just went to Heads Farm and you just drove about maybe, I don't know, 10 or 12 more minutes down the road, there is a beautiful camp there, and they are registering right now for the summer kids camps, which are very popular. If you haven't been out to Coldstream yet, you need to go check them out. They also have some really cool cottages there that you can rent for like a little retreat or a little conference. And so get out there, get a tour. I know a lot of you saw them during Experience Robertson County, but don't forget all the summer camps are fastly filling up. Some of them are already full. So make sure you go online to Coldstream Camp. All right, we are here with Dr. Wow, Doc. I know Laverne says Dale Brown. Every time she says Dale Brown, I'm like, who are you talking about? I only know you as Wild Doc.
Right.
Anyways, he has helped a lot of our friends, and that's why we just absolutely love having him on. And I always learn something. And so that's fascinating. You know, when you were first talking about ibuprofen and and Tylenol, is there, except for just like having maybe excruciating pain, like, is there really? I mean, when do you use those?
I never do. I mean, my wife had a C-section and she never used any ibuprofen or anything like that. We use herbs that don't block healing pathways. Like that's the ibuprofen use, and people who are like runners and athletes or people who have undergone surgery, like knee surgeries, things like that, can actually cause way more harm and actually have failure of surgical repair of tendons or ligaments due to ibuprofen use.
Wow.
So yeah, it's an anti-inflammatory. Yeah, it blocks that pathway, but you need inflammation for repair and healing. And so, runners who use ibuprofen on a regular basis have a much higher risk of tendon rupture, tearing their tendons. You're doing micro trauma tears to those muscle fibers and to those tendons, and you need to be able to repair them. If you block the repair mechanism by blocking the inflammatory, process that's needed for repair, a lot of times inflammation is said to be this horrible thing, and all diseases are rooted in inflammation. Inflammation is part of a process of a chronic disease, whether it's heart disease or diabetes or cancer and things like that. It's uncontrolled inflammation, but your immune system needs inflammation to kill off pathogens, to kill damaged tissue, to kill cancer cells. So if you block inflammation, and especially certain pathways, you actually increase your cancer risk. You increase your risk of those tendon and ligament and tissue damage conditions, those serious injuries. So if you have an athlete and you're just like, oh, they're sore after, we're going to pump them with some Tylenol and ibuprofen, you're creating more and more risk the more and more of those drugs they take, because our body should regulate that naturally, not chemically like with a drug. We shouldn't step in there and block it. So if we're eating the right things, if we're not hyperinflamed, if we don't have immune dysregulation, but I'm not saying if we don't have these things, so therefore those who do have autoimmune, they should take those drugs. It's not what I'm saying, but it's like if we are doing the right things, then we have the appropriate inflammatory response. And so there are certain things that are not going to inhibit that healing response, that inflammatory response, but could also help the brain nervous system deal with pain. Things like sensory input helps downregulate perceived pain in the brain. So that's why one of the mechanisms, you burn your hand and you rub it, or you twist your ankle and you hop around or you rub it. Well, that sensory feedback through the proprioceptive nerves in that area of the body inhibit the pain. So it's like you can inhibit the pain, not inhibit the healing process. Like, so I mean, there's sensory things that can be done. You know, that's one of the ways in which chiropractic helps us regulate the intensity of pain. And oftentimes when you have immobility, you're not getting that appropriate sensory feedback, so you can't regulate the intensity of pain. So that's why many people, when they start getting adjusted, many times they can get adjusted and almost like be like, whoa, I have way less pain right now. The mechanism by which that's occurring is through increased joint mobility. You're stimulating pathways of proprioception, and you're actually helping the brain regulate the intensity of that pain. You can also, through joint mechanics and feedback to the cerebellum, sending signals back down to those muscle fibers, can appropriately regulate the tone of those muscles. So when you're developing knots in your traps and in your shoulders, things like that, you're actually having a cerebellar tone issue. So the cerebellum is not firing to those muscles appropriately, and you have just chronic tone, or it's a chronic stress mechanically on those muscles that aren't allowing them to get relief, to relax, so that fluid can go through, blood flow can go through those. So many times knots are like a hypoxic area of the muscle fiber because they're just tight, staying tight, not getting relief. And if you just squeeze a muscle, you're compressing blood vessels. So that's where the hypoxia can come in.
Is that the main place where our traps are? Do we have other traps that?
Trap muscles here is what the muscle fibers are in the upper back.
Okay.
So
I have another question about, inflammation, because like, for instance, say you're dancing or whatever, and like, okay, your knee's a little bit inflamed.
yeah.
A lot of times, like, I would go and I would elevate and ice, but is there a certain amount, like, when is when do you let inflammation just do its thing, and when do you try to get it down? Like, how do you know good from bad and
I mean, I don't know.
is that just hard to generalize like that?
I mean, it is hard to generalize, I guess. I mean, if you're going and working out and you're starting to do those workouts and activities, there's a level of inflammation that's needed because you did micro damage to the muscle fibers and you're going to have it. So it's like with knees and things like that, are we dealing with a biomechanical issue with hips and pelvis or ankle? All the systems involved with appropriate alignment and movement of the knee. And if we've had previous traumas, can we get in there and do adjustments? Can we get in there and facilitate energy and oxygenation and a tissue repair mechanism, response with like red light therapy, laser therapy, things like that. And sometimes it's just move, and eventually those soft tissues around the knee are going to remodel. Mm-hmm. Now, what can happen is people with knee issues can have scar tissue that's built up, arthritis that's built up because of wear and tear or injuries in the past. And I'll get in there and do adjustments on the knee, and that breaks up that scar tissue, increases the amount of movement that they can get in that joint. And then ultimately, and there's also a neurological component where you stimulate with fast movement of the joint. A very rapid, quick adjustment stimulates a stronger response and coordinated movement to the cerebellum. So it kind of wakes the cerebellum up, and the cerebellum can take that joint information, send signals back down to coordinate movement of the muscles to keep the knee more stable. So stability. And so if we're adjusting, we're increasing movement, we're increasing fluid movement through the joint. And if you're eating the right things, and I would highly recommend doing things like bone broth and things like that, giving the raw materials. What I tell people that are taking a lot of supplements for joint issues, if they're not mobilizing those joints, like with a adjustment, if it's restricted the joint, to physical therapy once the joint motion is restored, and that means exercise basically. If you're not moving, you are not getting those nutrients you're taking in supplements into the joints, because joints don't have direct blood flow. So just ingesting something doesn't mean it goes into the joint. You need that raw materials, that collagen to go to. So you can't rebuild an arthritic joint unless you're moving that joint on a consistent basis.
Okay.
And that's what they show. Like, they show time and time again, in functional neurology, there's a professor, he's like, you know what? If I got somebody in chronic pain, I'll throw them in a pool. I don't even care if they can't swim. He's like, you make them swim. Like, they will get out of pain if you just make them move, 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 move. Time and time again, research shows that if you're dealing with chronic pain, you got to move. But sadly, what happens is we think if we're dealing with chronic pain, we just, I hurt, so I don't want to move.
Right.
And the initiation of movement can increase the pain because you are doing activities with those muscles and things like that for the first phase. And sadly, that's a hurdle many people don't want to jump over. And so it inhibits them and stops them from doing that activity that would ultimately, in the long run, really be beneficial for them. Both from the joint health, fluid movement to the joint, regeneration of soft tissue. They show that they can lock up a joint. And these are animal studies. They can lock the joint up and the cells within about 14 days start to deteriorate. That is why I have told people that I'd like to see people getting adjusted and maintaining the joints of their spine and other areas of their body, because we can adjust extremities too, maintaining appropriate and full range of motion, or the optimum range of motion for whatever age you're at. And if we maintain that, it's a lot better than waiting until it's deteriorated to the point where you're having serious problems, serious mobility issues, serious pain. Maintain it. But that's why within a month or every 2 weeks is a good wellness regimen for chiropractic. But if that joint locks up, you start the cellular deterioration. You start cellular death at about 14, 15 days in. And that's complete immobility. If there's a reduction, you might be able to go a little bit. If there's only a reduction in movement, it's not optimal movement, then it takes a little bit longer. But if you remobilize the joint, they basically take these devices, take them off the joint, reestablish mobility in the joint, and those tissues can regenerate. With white tissue, which is like joint tissue, cartilage, and ligament and tendons, it's avascular, meaning there's not direct blood vessels inside of those joints, because the compressive forces on those joints would cause the blood vessels to be squished so much that they wouldn't do any good. Anyways, they'd block the artery or blood vessel. So it's the movement of the joint that keeps them hydrated and healthy. So that is the simplest principle of chiropractic, is keep those joints moving.
I love that. And, I feel so sad when people think that arthritis is just, that there's nothing they can do about it.
Oh,
Because
there's
that's so
a ton
ridiculous.
that can be done for it. Yeah. No, I had a patient way back when, this lovely lady, her name was Beulah. And I've got a testimony from her, so I can share her first name at least. But she had 4 cervical spine surgeries.
Wow.
And she came in, her neck was, a mess. And I think she had like a couple car accidents and whiplash injuries and things like that. And I started adjusting her. And she kind of was like hesitant because, most of the time they go through surgery, they're worried about their neck, they're going to do more damage. But we started gentle adjustments on her cervical spine. And she had done checkups with her neurosurgeon in Nashville. And she went back and she told her neurosurgeon that she'd been seen by a chiropractor. At first, he was like, oh my gosh, I don't recommend that. I'm worried about it, but I want to do an MRI. He literally came back baffled. He goes, your neck looks better than it did prior to your last surgery. Like, this is amazing. Like, it's looking better. And he would do the MRIs and things were looking worse and worse and worse, thus more and more surgeries, because sadly what she was having done was spinal fusion surgery.
Oh.
And that stops mobility. So let's look at pain. Why is it well documented in the medical literature that those who undergo spinal fusion surgeries for things like arthritis, degenerative disc disease, bulging discs, things like that, actually have a higher likelihood? It's not even a flip of the coin. It's not 50% of the time, half the time that they're going to have improvements, and half the time that's not even the odds. The odds are 70% of the time those people need more narcotics, more pain meds. Because think about neurology. Rubbing your hand, sensory feedback. One of the largest sensory feedback your brain gets, proprioceptive feedback, is through joint movement. So if you do a fusion, you lock the joints up. You automatically downregulate, substantially reduce proprioception to the brain that helps you regulate the intensity of pain. So like flat out simple neurology says reduce movement, increase pain. That is, you should expect that.
Mm.
Like that is what is expected
Mm-hmm.
in neurology.
Mm-hmm.
And fusion surgeries are done on the spine. That's why we had a government committee back in I think it was early 2000, got a paper on it. And there were 5 committee members. Multiple of them actually had financial ties to the equipment used in spinal fusion surgery.
Oh, what do you know?
But I say that because I usually people are like, oh, yep, it's going to be biased. And they said it was good. Actually, on a scale of 1 to 5, they voted a 1.5. 5 being very effective, very beneficial. Government should pay for it. With that scale, that rating, they were going to stop government payments through Medicare, Medicaid, and other insurance companies. Stop paying for a worthless, harmful surgery. It qualified as harmful more frequent than helpful.
Mm-hmm.
And guess what? The National Association of Spinal Surgeons lobbied against in the government, got politicians to vote to reduce the funding of those committees in that government entity, and they squashed them from halting the fight. So Doge, you want to know how to save money? Go back to that document, take their advice, and stop paying for spinal fusions because they're more frequently harmful.
Wow. So much good information, and it's almost quarter till, so we need to talk about a couple more people here. Let's see. How about Southside?
Nothing can compare to the down-home customer service that you receive from a small-town, family-run drugstore like Southside Drug Company. Stop in and talk with the friendly staff. They've been specializing in hometown customer service for over 100 years. Store hours are Monday through Friday, 8 a.m. to 6 p.m., and Saturday, 8 a.m. to 4 p.m. For more information, visit SouthsideDrugCo.com. Be sure to tell them Lee Marie sent you. Join me, Lee Marie, every Wednesday morning, 8 a.m. to 9 a.m. on WSGI for The Go Show, your source for information, inspiration, and always some dates to add to your calendar. And every
It's a new year. Time to book an appointment at DK Styles and Tanning. They offer haircuts for everyone: styling, color, perms, waxing, spray tan, and tanning beds. DK Styles is a big supporter of our military and first responders, offering them haircuts for only $20. DK Styles is conveniently located at 3538 Tom Austin Highway in Springfield. Open Monday through Friday, 9 to 7, and Saturdays, 8 to 3. Book an appointment online, mysalononline.com, or call 615-384-8999.
Done, family.
All right, we are back in studio with Wild Doc, getting so much good information downloaded, and I had to tell him on the break. I said, I love that reduced movement equals more stress or more pain. So I'm going to be telling my dance students.
Swim, dance,
Yes.
move. Praise the Lord,
That's right. And, I was thinking about myself too, because I haven't been having pain, but I've been dancing more, because of the class. So that was one reason why I wanted to start teaching, really.
Yeah.
People are like, how come you're not marketing a lot and getting more students? I'm like, actually, I kind of started just so that I would be doing I'd be forced to
It's a
exercise.
selfish reason,
Yes, I
Lee.
know. Isn't that terrible? But I really am not having pain. And I used to, have to get home and elevate and ice and all that.
Yeah.
I haven't had to do that. And I was thinking the other day, I'm like, but I'm dancing, more than I was. And so now this all makes sense.
Yep.
And then the people out there that are saying like, oh, I don't want to do swimming or dancing or whatever because I have arthritis and I don't want to irritate this, knee or this wrist or whatever. We're hearing the opposite.
Yeah.
You got to move it or lose it, right?
And sometimes they're like, I don't want to move it because when I begin to move it, it hits this point where there's an increase in pain. So that can be a biomechanical problem due to a subluxation, due to inappropriate alignment, or you have adhesions and scar tissue from an injury that has gone across the joint space and you're hitting that stretching point where it can't move further than that, and that creates the pain. I mean, I've had people that have been like, I can't move my wrist like this, doc, and past here when I do a push-up, it hurts really bad. I'm like, let me see your wrist real quick. Move the joints around. Oh, there's a fixation right there. fixation is not moving in appropriate alignment, and it should have that biomechanical movement, adjust and thrust into it. Sometimes it smarts in that moment. Many people like pop and they're like, oh my gosh, I can move my wrist. Huh. And I've had people like do a push-up, right? They're like, are you serious? I'm like, yes, because we just restored proper biomechanics to the joint. You just needed a little bit more force. Your body was inhibiting muscle contraction because you were in pain, so you couldn't like pop it yourself in essence. And while popping it, many people will be like, I can pop my knees and pop my back and pop my neck. You may be causing dysfunction long term because the typical individual can pop the joints that are already mobile. They can't the ones that are seriously restricted, and all you're getting is a proprioceptive stimulus that, yes, helps you control pain, but yet actually isn't restoring joint mechanics of the most restricted joint. So there can be, you got to understand that so that you don't get into a problematic issue from, and hurt yourself doing that type of thing. But it's reestablish a proper biomechanics is the key point there.
Since you were talking about risk, can we just, I'm a little bit frustrated at something. Again, another friend going in for carpal tunnel surgery.
Yeah.
And I am frustrated because I had been scheduled to have surgery a couple times when, thank God, somebody came into my life that said, you know what, let's look at other things. And so can you address, like, why do people think that carpal tunnel surgery is like, now it's like the new tonsillitis thing. You know what I mean? Everybody was ripping out tonsils for a while. Now everybody wants to get carpal tunnel surgery.
It's
frustrating.
It's a prevalent issue because what is the primary mechanism of carpal tunnel? It's desk work. It's posture. It's not the use of the wrist. The carpal tunnel is a pathway or kind of an area, space through which the carpal nerve, the nerves go through into the hands, and they're in the wrist. And so it'll cause pain, but it's a tethering effect on the spinal cord. So like carpal tunnel surgery doesn't have that great of efficacy. Many people, it fails. I had a lady had undergone 4 carpal tunnel surgeries. She had an S curvature in her neck. You're supposed to have a C curvature. She had an S, which creates, depending on the person's height and body, it can create 9 to 11 additional centimeters of tension on the spinal cord. That's a long distance when you consider a person who's 5'5", this lady. And so that tension on her spinal cord, it's like if I pull this cord attached to this microphone and it's locked in place through a tunnel and I pull it tight, it's going to put pressure right at that tunnel. If it's a tunnel that's hard tissue, bone, it's going to put pressure on that nerve and you're going to have pain there. If I let go of the cord, there's no longer pressure. So if this nerve, this cord, is being tethered and pulled, every corner tunnel it goes through is going to have pressure. So that's why people have carpal tunnel first, then they'll have ulnar tunnel surgery next, and then they'll have spinal surgery.
Yeah, ulnar was the other one that I was scheduled for, and thank God I had a friend that said no.
Because if you don't correct what's causing the pulling effect, which is a alignment of the cervical spine, which is posture driven, which then pulls on the nerves that then causes the pain in the carpal tunnel, surgery to bore out the hole bigger, it's like pull a garden hose around a corner. Not getting enough water flow here, and then that causes you pain. But to my garden, I'm going to go to the corner of my house. Instead of letting slack, I'm just going to bore out the corner of my house so that the hose has less pressure on it. That's, again, go to a surgeon. What are you going to get recommended? Surgery. Go to a man with a hammer. Go to a man with a knife. What are they going to fix you with? Or attempt? But they're not fixing you. They're ignoring a symptom of a bigger problem. Because while the nerves in the arms, they give you pain, they give you symptoms, there's your check engine light, but yet the nerve fibers, you're going to have less vital areas of your body, like your arms, innervated by nerve fibers that are outside of those big bundles of nerves. On the inside, you've got your heart and your lungs. That's why people who have carpal tunnel have more risk of cardiac problems.
Interesting.
That's why women who have the Dowser's hump, like look at most women and individuals, women seem to form the Dowser's hump way more than men because of more hormonal and inflammatory process. But that hump on their back of their neck, they have an increased risk of cardiac death because it's a posture-related indication that the alignment of the spine is out in that area in their upper back where the nerves branch to the heart. Dowser's hump's associated with carpal tunnel. So it's like we need to take and say, why would the body have these symptoms? It's not because we don't have a bigger hole there in the carpal tunnel. You're just boring out a hole to take a pressure that's caused by tension on the spinal cord and the nerves. While it may be short-term pain relief, bigger problems will come about because you ignored your check engine light. That's the reality.
Such good information. All right, we got to do one more commercial break, and then we come back. We'll give some more information about your hours and how they can find you and all that kind of good stuff. But this is Wild Doc, a.k.a. Dr. Dale Brown. I think one of the best things we have right here in Tennessee. So if you're listening anywhere in Tennessee, it's worth coming to finding him and letting him help you. All right, let's see. We got our last commercial break here.
Now is the time to clean out that shed or garage. Ridgetop Mower offers free equipment removal, service and repair of mowers and small engines. And now, service on kerosene heaters, wick replacement, and service for all torpedo blowers. Same-day service on most repairs. Pickup and delivery available. Ridgetop Mower open 8 to 5 Monday through Friday and 8 to noon on Saturday. Call Gary at Ridgetop Mower 615-855-0044 and tell him Lee Marie sent you. Happy New
All right, and I do want to add that it is time to get your mower serviced because it's time to start mowing out there. So I'm going to update that ad. I know we don't need heaters anymore, but Gary's great, and you can get these really cool WSGI stickers over at Gary's, and he's just right behind Ace Hardware off of Central there. And also mention WSGI in the Go Show, and you will get 10% off your parts and or service. So get over there and see Gary at Ridgetop Mower. All right, I'm going to actually run one more commercial break, and then we will wrap it up with Wild Doc.
At the UPS store, we have everything to help small business owners be unstoppable. So you
Tell you about it. So UPS, you guys all saw Deborah last Wednesday. She filled in for me. Thank you, Deborah. UPS has some of the best customer service, and they are right there on Memorial Boulevard, really close to HG Hill. And you can go in. Of course, they do all of your normal Amazon returns and stuff like that, but they also have boxes and bags to ship everything. So if you have something that you want to send as a gift and you're like, I don't really know how to pack this, they are expert packers. They also have in-house person that can design your flyers or your booklets, your business cards. So get on over out to UPS and see, they have a big binder actually of all their services. They have a lot more things than you would think just a print shop has. So go and tell them that you heard about it on The Go Show. So that is all of our commercials for today. So now I can let Wild Doc tell everybody how to find you and your hours and stuff like that.
Just off exit 11 in Clarksville, Tennessee. The phone number there is 931-591-2010. And we have some hours Monday, Wednesday, and Thursday in the morning and evenings for adjustments. We also do functional medicine, functional health coaching. I am working through certification in functional immunology, so we work with a lot of people with autoimmune conditions, serious immunological problems, chronic illness, things like that. And then I am going to be starting functional neurology work as well.
Excellent.
Working with kids with developmental conditions and developmental delays. Just so happen to have up in front of me a article about the mistaken diagnosis of autism in a child who actually had celiac disease. And so once they identified that the child had celiac disease and they removed gluten from his diet completely, the child's neurodevelopmental condition completely resolved and he normalized.
Wow. That's
because the cross-reactivity of gluten can cause damage to certain regions of the brain and nervous system.
Wow.
His brain was inflamed due to this cross reactivity. And once they got rid of a trigger of inflammation of his brain, the metabolic capacity got out of what I call, he was in a state of defense, always defending himself against inflammation and damage. And then he could actually go into development, and he accelerated in development and caught up to his peers.
That is amazing, because I know how, autism, well, quote unquote, autism has just shot through the roof, but I wonder how much of that is.
And, again, that's not everybody.
Right.
But it was like,
in that.
because of the cross reactivity of antibodies against gluten, also were triggering inflammation and damage to areas of his brain to where it couldn't develop appropriately once you remove the triggers. And that just shows there's the amazing design of God and how he designed the body. That's like, it wasn't like complete brain damage and loss. It was actually like an inhibition of development. And so once they got rid of that inflammation, his brain accelerated in development and caught up.
Wow.
And so it's like, how many kids out there
Yeah.
are being, well, this is just this is just the way my kid is, and
Guys, are you listening to that? Because you need to share this show. I know all of you have friends that, have kids with autism, and like he said, it's not everybody, but in some cases that might be the only thing.
Yep.
So, oh my goodness. Wow. Don't forget.
we do the testing in our clinic, just
Oh, you do?
FYI. Like,
Okay.
a lot of times I think people may think, well, I'll go to my doctor and ask. Well, why
Mhm.
don't you come to the guy who
Really can
put
help
the
you.
information out there?
Yeah. And guys, remember, WSJ also has phone apps now, so you can get that on your iPhone and on your Android as well. And then this show is also being recorded on Facebook and YouTube. So I know not everybody has a Facebook account, but you can find it on YouTube and share that, because, we are a Christian station, so our feed just doesn't fly around Facebook that much. We have to actually send it to people on Messenger and say, hey, check this out. Well, there was so many different things that you brought up today, just these little nuggets that there's like something for everybody in this show. I think I really do. Is there anything else? We just have a few minutes left. Is there anything that you want to end with, or?
I don't know, not on my mind necessarily.
Okay.
I mean, we are beginning to implement functional neurology. Here's
go
a great little testimony. I had a lady with severe vertigo that literally could barely walk a year ago. And she came in yesterday and she's like, Doc, you'll never guess what I did yesterday. She's like, I went ice skating.
Oh my goodness.
Like, where do you go ice skating this time of year? But it's probably there at the center there in Clarksville, I bet, is where I didn't
that's
ask her where she
awesome.
went, but I was just super excited for her. So she was just like, I feel so much better. I'm doing so much better. We had another lady here recently that we've been working with for several weeks, and we've been doing adjustments which help the biomechanical integration of the cerebellum and vestibular system. That's kind of the science behind chiropractic for that purpose. And then also doing laser therapy on her cerebellum and vestibular system. And she's literally like, it's like my brain is turned on. She'd been dealing with vertigo as well, dizziness, and just like severe brain fog. And this all came about post-COVID, actually. And so, we were getting energy to her cerebellum with laser. And then we are doing adjustments to integrate those systems, work with them, stimulate them so that they can coordinate again. And she's doing fantastic.
That's awesome. Well, speaking of the word functional, it's so nice now to start hearing more people, just mainstream people, using it. It's finally. Can you give everybody a definition of what you say functional means?
Well, it's restoring the normal physiological function that takes place for your body to be healthy, well, and everything to be coordinated. And so, back in the day, I used to almost make fun of functional doctors, because I'm like, what controls all function and healing in the body? It made me like, oh, that's like your metabolism, or your gut was the biggest thing, and things like that. And I'm like, the central nervous system controls all function and healing in the body. So the original functional doctors were chiropractors. And now their terms are being used because it's like, okay, so there's the way in which the Krebs cycle and the mitochondria and the cellular detox mechanisms and the liver functions and things like that. It's all coordinated through nervous system primarily, but you need raw materials, you need good chemistry, you need good metabolic health, you need to eat the right things. You know, you use herbs and supplements to help balance things out or stimulate things in a certain direction to heal and repair. And so, you know, it's helping those organs function better by giving them herbs and God's medicine to allow them to work better. So it's facilitating recovery and regeneration and healing. So like functional, now there's functional neurology because, you know, when you look at seizures, people will look at the brain MRI and there's no mass, there's no tumor, but the nervous system is firing when it shouldn't. It's not functioning correctly. So now they're seeing that with functional neurology, you can actually resolve seizures. You know, and when you look at the functional aspect of the metabolic system, its impact on keeping nerves from firing when they shouldn't. And again, most of the energy in the brain goes towards inhibiting inappropriate firing and firing when nerves should not. So if you have an energy depletion and you're closer to firing threshold, then you get seizures and involuntary movements when you shouldn't. Well, if it's a metabolic component, then looking at it from how the body functions from a metabolic state, restoring metabolic health, oftentimes could even relieve seizures and things like that. So it's like, I'm just giving examples out there. It's like a little girl. Here's an easy one. Severe constipation, doing enemas, anal stimulation to try and get the bowels, medications, Miralax, all these things. And it's like, I'm like, when did it start? It's been her whole life. I'm like, so her bowels aren't functioning. And so I was like, if this has been her entire life, I believe it's probably in the central nervous system. All right. I don't think it came about after antibiotic use, which is associated with constipation and problems with the bowels. So I'm like, I don't think we need to do a stool sample on her. I think we need to start adjusting. And the mom was nervous and she's like, I just don't understand how popping her spine, her neck, and her lower back and like pushing on her hips there are going to, I'm like, well, you have a sacral plexus that carries information to the lower colon that is coordinating reflexes that send signals to the brain that then enhance the signaling back down through those nerves to those muscles of the colon to defecate and release. And I was like, that's how it works neurologically. And I'm removing interference because her spine is not in the proper alignment. It's not moving correctly. It's causing a stress response at these areas that inhibit appropriate signaling. They're blocking those nerves. It's the easiest way to explain it. It's not exactly the way neurology works, but I'm like, similarly, give me time. And just slowly that child, this 3-year-old girl, starts pooping. And we just put that testimony out here recently. And now her body is functioning again. So when we use the term function, it's about restoration of the normal and healthy function of your body.
All right, very good. You've been listening to Wild Doc. He is over there in Clarksville, and make sure you give him a call. The phone number one more time to the office.
931-591-2010.
Great, awesome. You guys have been listening to a special edition Go Show, and I will be back on Wednesday. So I hope to see all of you guys out again at the Vietnam Veterans Day celebrations tonight. The candlelight vigil starts at 6 p.m. right there at Springfield Memorial Gardens next to South Haven. And then, of course, tomorrow, Saturday at 12 noon, we're having Dawn and Brian Wilson are going to be our MCs. We're going to have a great ceremony from 12 o'clock to probably about 2 or so, right there at the same place. Look for the 300 white chairs outside right on Memorial Boulevard. Please come out and support our Vietnam veterans, our bravest generation. All right, guys, God bless. I love you all. You've been listening to 1100 WSGI.